For a couple having regular sexual intercourse, the chances of conception within a month is between 20 to 25%. When it gets to 6 months, the chances go to 75%. Then in 1 year, the chances of conception goes up to 90%. That is why we give you a duration of 12 months or more before we can begin diagnosing infertility. So causes of infertility in men. We should all know that in most cases, there are cases where you come to the hospital and we fail to find the causes of infertility. We call that idiopathic. So idiopathic causes or causes that we do not know. The doctors fail to find what is causing the problem. We call it idiopathic causes. It accounts for about 25% of infertility cases in men. Then we have varicocele. Varicocele is an enlargement of the blood vessel that takes away the oxygenated blood from your testicles. So varicocele accounts for about 40% of infertility in men. Then we see that in adults, varicocele is so common that about 15% of adults have it. Then when we come to adolescents, varicocele is about 20% among adolescents, but majority live asymptomatic. It normally causes no problem, but there's where someone has varicocele and they have symptoms, can be dull pain within the testicles or swelling of the testicles. So varicocele accounts for about 40% of infertility cases in men, but not everyone with varicocele will have infertility. Then we go to undescended testes. Undescended testes is where the testes has not gone down to the sacs, to the testicles. Undescended testes is associated with infertility because we saw that for our testes to manufacture sperms, they need temperatures that are a bit lower than our normal body temperature, which is 30 degrees Celsius. So our testes need about 35 degrees Celsius to manufacture sperms. So if you have testes that have not descended down there, so they will in most cases experience the same body temperature, which is 37 degrees Celsius, which is not favorable for manufacturing sperms. Then secondly, you have undescended testes, you are more prone to injuries, so the testes are not protected. So that's why we are saying undescended testes in men is associated with infertility. Then we go to functional sperm disorders. Functional sperm disorders, we have things like anti-sperm antibodies. It is under immunological infertility. Anti-sperm antibodies is where a man's body recognizes his own sperms as a foreign body. Therefore, they produce ascaris or soldiers that should fight against it, and therefore destroying his own sperms. Then we go to defects. Defects, we have the likes of cartigenous syndrome. In cartigenous syndrome it comprises of a triage of things. For example, we have this kind of a man is having recurrent sinusitis. You have grown with recurrent sinusitis, and then you're also having situs inversus, and you're having bronchiectasis. So such a man, you have been living with the recurrent sinusitis. You have had people saying, I have sinuses, I have sinuses. If you grow up like that and you begin having problems with conception, you need to go and see your doctor, because people with cartigenous syndrome normally have immotile sperms. The immotile sperms is also reflected on the immobility of their cilia within their airway. That such a person with the cartigenous syndrome, they have visible defects that can be seen along the cilia of their airway at the same time in their sperms. So their sperms are immotile. They are unable to move because of abnormalities within their cilia. So we can go to the next and common one. We have erectile dysfunction or impotence. Erectile dysfunction or impotence is where a man either is unable to attain an erection, or he can achieve an erection but is unable to maintain this erection strong enough for effective sexual intercourse. That is erectile dysfunction. It is so common. We saw in the introduction how it is increasing at a very rapid rate among men. So erectile dysfunction, you are unable to maintain an erection. Therefore, your chances of ejaculation is also very low. So in most cases you find that you are prone to infertility even if you're having good sperm function. Then we can go to the next thing. We have people who are having ejaculatory problems or dysfunction. Ejaculatory problems or dysfunction, for example, we can go to the straight one. We have retrograde ejaculation. Retrograde ejaculation is that this kind of a man is able to have sexual intercourse, attain orgasm, but he does not see sperms coming through his urethra. Or if he's seeing, it is very little. That is because the sperms are going into his bladder instead of coming through the urethra out of the penis. The sperms again go backward to the urinary bladder because the urinary bladder sphincters are weak or have default in them, so the sperms instead enter there. That's why when you go to hospital for infertility issue and your doctor may say, okay, let us do a postcoital urinalysis. Then let's do a urinalysis examination after you've had sex because of this retrograde ejaculation. So we may go to the next. Before we go to the next, if you're always having such where after ejaculation you see you have very little sperms, or you don't see sperms and yet you are achieving orgasm, you may need to go see your doctor because you may be having a retrograde ejaculation. Then we can go to one next common one. The next common one is testicular injury. Testicular injuries, it can range from orchitis. Orchitis, we have seen that it is an inflammation of either single or both testicles. And this inflammation, we have seen that it can range from bacterial or viral. We have seen that it is even so common these days that people who are having chronic orchitis, in most cases, they have syphilis. Orchitis is associated with infertility because you have seen physically that when you open the testicles, you find visible scars. So that is orchitis. It is part of the injuries. Then we can look at testicular torsion, where the testes are twisted. When you twist the testes, you find that the lower parts get deprived of oxygen supply and therefore they easily die out. So testicular torsion is also a cause of infertility in men. Then we can go to trauma, accidents. Playing football, you get kicked accidentally into your testes. Those injuries can also lead to infertility. Then we have radiotherapy. People undergoing radiotherapy. We know how dangerous those radiations are. We can go to the next one. Maybe it is now number 8. We can go to endocrine disorders, which is so common and complex. For example, when we are talking about endocrine disorders, we are talking about things that alter the balance of our reproductive hormones. Yes, so we can go and start maybe from Kallmann syndrome. Kallmann, that is Kallmann is Kallmanns. That is Kallmann syndrome. Kallmann syndrome also is comprised of about two things: that this kind of a person has had either delayed puberty or has had an incomplete puberty. Then at the same time, either he lost sense of smell or he did not develop sense of smell. So you're that kind of a person who has had history of delayed puberty. At the same time, you do not have sense of smell, and then you're having problems giving birth. You may need to go see your doctor because this Kallmann syndrome comes with what we call hypogonadism. That in the hypogonadism, that we have the testes are unable to produce enough testosterone to make a man develop into a typical male. That is Kallmann syndrome. Then we can go to the Prader-Willi syndrome. Prader-Willi syndrome, this kind of a person is also associated with hypogonadism. We should note that in hypogonadism, we are seeing small genitalia or small testes. Yes, that's and is a physical sign you can maybe identify yourself with. Then we look at short stature. This kind of a person is short. We look at hyperphagia, then obesity. Hyperphagia is where you have constant hunger. You're always hungry and therefore you eat a lot, and then you're obese and you're short and you're having hypogonadism. Your genitalia is small or testes are small because you had because the small testes fail to produce enough testosterone to make the masculine that is needed for a man. And also this kind of a person is having intellectual disability. So that is Prader-Willis syndrome. Then maybe we can look at pituitary gland adenoma. In pituitary gland adenoma, we know what the pituitary gland in men is producing. We are talking about follicle stimulating hormone. We are talking about luteinizing hormone production. All these get altered when someone is having pituitary gland adenoma. Then we can look at hormonal excesses. For example, you have excess of prolactin, which can be from pituitary tumor. It is also going to cause you infertility. Then we are looking at excess of androgen. Excess of androgen can range from use of anabolic steroid, like for the bodybuilders, the gymming men. Anabolic steroids is synthetic testosterone. That is something that we need to build our muscles, the body, for those that are going to the gym. Then we're looking at congenital adrenal hyperplasia, adrenal tumors. All those cause androgen excesses. Then we're looking at excess estrogen in men. Excess estrogen in men, we know it is associated with gynecomastia. You have big breasts. Then we are looking at erectile dysfunction. Yes, all those are things that are leading us to infertility. Maybe we can look at the next item is male genital tract obstruction. Male genital tract obstruction can range from a variety of things. For example, we can have a congenital absence of vas deferens, which is the same as the sperm duct. Yes, you can be born without it. Then we can have agenesis of seminal vesicles. Seminal vesicles are those that produce the fluid that make up the semen. You may be lacking it. Then we can look at Wolffian duct abnormalities. Wolffian duct is an embryonic structure that in male it can develop into the internal genital organs. So when you're having Wolffian duct abnormality, you are most likely going to have an infertility. Though the Wolffian duct in women, we say it regresses as women grow, but in men it persists and then differentiates into the internal genital organs in men. Then you can have epididymal obstruction or infection. Epididymis, we know that it is the tube where sperms are stored and they undergo or they grow from. They undergo their development from the epididymis. So if you're having an infection in the epididymis or you're having an obstruction of the epididymis, you have gone to hospital, they have done an ultrasound scan and they are telling you you're having an inflamed epididymis. You should know that is something that can affect your sperms directly because it is where the sperms are stored and grow from. Then we are looking at Mullerian prostatic cyst. The Mullerian duct in men, we see that as we grow it should degrade, it should disappear. Then in women, it is what grows and becomes their reproductive system. They are parts of the reproductive system. But in men, where it persists, we end up with what we call a Mullerian duct cyst, or we can have a Mullerian prostatic cyst. Then we see other things like inguinal surgeries, or we can have a pelvic surgery that is causing an obstruction. Might be a damage or might be any mistake that has happened during the surgery. Then we can go to the next thing. So there's a lot that causes infertility in men. That's why you need to go to the hospital in case you're failing to make a woman conceive. Then we can go to the next one, common one, infection. Infection, for example, we are saying genital tract infection can account for about 10 to 20% of infertility in a male. Yes, when you have the urinary tract infection, can range from even STI. You go to hospital and you do not get prompt treatment for a long time. It causes you challenges. For example, we are saying chlamydia trachomatis has the ability to attach and penetrate the sperms. That is one way it can cause infertility. Then other infections can range from bilateral epididymitis or inflammation of your epididymis. It reduces the sperm quality because we saw that epididymis is where the sperms are developing from. Then we are looking at previous prostatitis. We are looking at as far as HIV infection. So those are infections. You get genital tract infection, go to hospital and get prompt treatment, an appropriate one. Then maybe we can go to the next item, or we are looking at drugs. Drugs can range from chemotherapy for our brothers and sisters who are battling cancer. Then it can range to anabolic steroids. It can people who are misusing anabolic steroids, especially the bodybuilders. It comes with consequences. We can go to as far as alcoholism. We go to as far as smoking, marijuana abuse. Then we can go to as far as sulfasalazine, those that are being used for managing symptoms of inflammatory bowel diseases. Then we can go to environmental factors that we saw in our introduction, that we have pesticides, heavy metal, hot bath. We saw how pesticides were affecting males that are living in agricultural area in the United States, where it made them, even those who are not doing the agriculture but are just residents within the state, were having a half the sperm count that were that their friends who were living in non-agricultural regions were having. So those are environmental factors. Then we can look at systemic diseases. Systemic diseases, we normally want to consider them where we are failed to find any other obvious causes. For example, renal failure, liver cirrhosis, cystic fibrosis. Those are systemic diseases. We want to shift to them where we have failed to find any other obvious causes. So they are also capable of causing you infertility. Then we can go to the more scientific factor, the genetic factors or genetic disorders. We should recall that in our introduction, we said we do not want to really consider evolution, because we are seeing that from research, it shows that within 50 years, we have 50% of sperm concentration that have been reduced. And we concluded by saying that is too rapid for us to consider evolution. So in the genetic factors, we are looking at very many genetic disorders. For example, we have the Klinefelter syndrome. In the Klinefelter syndrome, we are talking about the 47XXY with azoospermia. We are looking about increased follicle stimulating hormone or luteinizing hormone with a decreased testosterone. That is for those who are having Klinefelter syndrome. We are looking at the XX male and the XYY syndrome. The next genetic disorder we are talking about is deletion in the azoospermic factor, that is the AZF gene on the Y chromosome, associated with abnormal spermatogenesis, and it is also inheritable by male offsprings. Then we can look at the next. We have the microdeletion of region AZF small a, which is associated with Sertoli cell only syndrome. Then we also look at the next genetic disorder being AZFB, small b, with maturation arrest, and AZF small c with azoospermia or severe oligozoospermia. So those are genetic disorders that are associated with infertility. Then maybe we can look at the obvious risk factors, which is history. So you come to hospital, you're telling a doctor you are failing to make a woman conceive, then the doctor wants to know your history. Your history can range from sexual and reproductive history, where your doctor will ask for the duration of the problem, can ask for the frequency and timing of your sexual intercourse. Your doctor will ask for use of vaginal lubricants, where some of those vaginal lubricants affect our sperm functions. Your doctor will ask for previous successful conception. Have you ever made a woman pregnant? Your doctor will ask for previous use of birth controls of your woman, or even you, because we have people undergoing vasectomy. Then your doctor can go as far as asking you for history of having had erectile dysfunction or ejaculatory dysfunction. Are there periods where you had problems trying to achieve erection or maintain erection? Your doctor can go as far as asking about your partner's history, which can range from the age of your partner, can range from whether your partner has had previous pregnancy. Has your partner ever been pregnant? Your doctor may ask for medical history of your partner. Your doctor can ask for previous investigation of fertility of your partner. Has your partner ever gone to hospital to be investigated for infertility or subfertility? Then your doctor may want to ask about your developmental history. That at what age did puberty start or end? Then at what age have you had undescended testes? Have you had gynecomastia, big breast? Then your doctor may want to know about medical and surgical history of you. Have you had history of tumor or any tumor anywhere? Have you had recent febrile illnesses? Did you have post-pubertal mumps infection or otitis? Your doctor will ask for history of varicocele. Varicocele, we have said testicular varicocele can be visible because it is an enlargement of the blood vessel that takes away blood from your testes. Your doctor may ask for history of testicular torsion, twisting of your testes, that comes sometimes with an acute pain that is unbearable. Your doctor can ask for history of trauma, can ask for history of chronic STIs or UTI, can ask for history of genitourinary surgery or pelvic surgeries, can even ask for history of radiotherapy, diabetes mellitus. So those are medical and surgical history. Your doctor may even go as far as asking about your family history, which he may ask whether you have anyone in the family who is infertile. Brother, sister, anyone who is trying to have problems of giving birth. Then in your home, is there anyone who has had history of hypogonadism, undescended testes? Your doctor may want to ask about your drug and environmental history, which can range from previous chemotherapy. Have you had chemotherapy before? Exposure to substances which impair spermatogenesis. Then your doctor may ask for a history of intense alcohol use or smoking, even hot bath. So those are things that we group as risk factors or causes of infertility in men. I think in our next episode we are going to look at the investigations we do for infertility in men. When you come to the hospital, what tests are your doctors going to do to investigate why you are failing to make a woman conceive?